Soto.
Hi, Amy.
So I heard about this new procedure where you can use your own fat to enhance the size of your breast. What are your thoughts and opinions on this?
Well, I think that more research is needed, is the bottom line. You know, Amy, that I do a lot of fat grafting, actually. I've been doing fat grafting for many years, and so have a lot of other plastic surgeons, so I don't want anybody to think that I'm the only one who knows how to do that. That wouldn't be responsible. Fat grafting has been around for a long time, more than 20, 25 years. And we know that it works, and we know that for the most part it's safe in the areas that we've been doing it, which are the face, and obviously I do a lot of buttock fat grafting in the Brazilian butt lift technique. The concerns that I have, and that many other reputable, ethical, responsible, board-certified plastic surgeons have, is that the breast is a totally different situation. Okay, so if we talk about fat grafting to the face or fat grafting to the buttock area, the truth is that we don't have a lot of people dying of cancer of the face or cancer of the butt in the United States. We just don't. But unfortunately, 1 in 8 women in the United States now is developing breast cancer, and it's a huge problem. I personally have lost friends, family members to breast cancer, and I'm deeply concerned about anything that we might be doing that is going to increase somebody's risk for either developing breast cancer or having trouble treating it. And here's the problem. Fat grafting to the breast has been tried before. It's not like somebody just thought of it now. The first breast augmentation over 150 years ago was actually done by transplanting a little fat from somebody's body to their breast. So this has been done before, and it's been going on, for years. The biggest problem with it, as far as I'm concerned, is that not all of the fat always survives. Whether we're doing it in the face, the buttock, or the breast, some of the fat is going to be reabsorbed and turn into scar tissue. It's inevitable. A little bit of it will always do that. And the problem is that it's already been proven that when fatty tissue in the breast turns into scar tissue or is absorbed, it can look on x-rays a lot like a breast cancer. If that's not bad enough, sometimes the fat can be a little bit lumpy, okay, which is a big problem because that's how a lot of women find their breast cancer, when they find a little lump in their breast. Well, if we create lumps in the breast just to make them look a little bit better, it's going to be hard for the patient to know if it's a lump she needs to take seriously or not. So even if we don't really create breast cancer by doing this, I think that we are going to be creating a lot of confusion, and I think that a lot of women are going to be needing to undergo biopsies, to find out if they have breast cancer that they might not have needed to have if we hadn't put fat into their breast. And if you think about how scary it would be to be thinking I might have breast cancer and then have to go through an unnecessary biopsy operation to prove that you don't, I'm not sure that most women would think that it was all worth it just to have breasts that are a little bit bigger. I think that after some time goes by and more research is done, it may be that we figure out a way to do it and figure out a way to tell the difference between breast cancer and scar tissue from fat grafting to the breast. But right now, we just don't have that information. And what we do know is that 1 in 8 women gets breast cancer, and that when you put fat into the breast in these techniques, sometimes it can look like a breast cancer. And those two things, those two facts, I think for me as a board-certified and ethical and responsible provider of plastic surgery, make me feel like it's just not the right thing to do right now. The unfortunate thing is that not everybody is as careful, I think, as I am, and I know that there are doctors who are not board-certified plastic surgeons, by the way, in Orlando offering this technique to women already and telling them that it's safe and telling them they've got nothing to worry about. And I think that's really a shame. People need to be very careful because it may work. I think it is possible to make the breasts a little bit bigger by putting fat in there. What I'm not sure about is that it's in the patient's best interest long term.
So for now, it's best to stay away from it until a little more research is done.
Absolutely. I think that the only safe and effective way of making your breasts a little bit larger is still breast implants, whether they're saline or silicone. Again, 10 years from now, things may have changed and we might have figured it all out. But right now, I think it's a case of people's excitement getting a little bit ahead of the science and the safety. And I would be worried about anybody that I knew or cared about having that done.
Okay, well, thank you so much, Dr. Soto.
Sure.
We'll see you next time.
Okay.